NCLEX-RN Actual Questions Exam Practice. Question 1. The nurse is evaluating teaching effectiveness on a client with a gastrointestinal disorder prescribed a gluten-free diet. Which diet choice indicates that the client understands the instructions given? Option A. Client with COPD is in respiratory failure. Which of the following results would be the most sensitive indicator that the client requires a mechanical ventilator? Option B. Blood pressure. Option C. pH 7.23. Option D. Bran cereal. The correct answer is option Nan. Deep tendon reflexes blood pressure urine output tissue turgor PCO 258 SAW 290 pH 7.23 HCO 330. Question 2. An elderly client with glaucoma has been prescribed Timoptic, timolol, eye drops. Timoptic should be used with caution in clients with a history of Option A. Diabetes. Option B. Gastric ulcers. Option C. Emphysema. Option D. Pancreatitis. The correct answer is option Nan. Question 3. The nurse is caring for a client with suspected AIDS dementia complex. The first sign of dementia in the client with AIDS is Option A. Client has a tentative diagnosis of myasthenia gravis. The nurse recognizes that myasthenia gravis involves Option B. An interruption in the transmission of impulses from nerve endings to muscles. Option C. Problems with speech. Option D. Seizures. The correct answer is option Nan. Close assessment for signs of bleeding is needed. The dosage of Coumadin is inadequate to prevent thrombi. The client should limit the intake of foods rich in vitamin K. Skipped doses should be made up by taking an additional dose. Loss of the myelin sheath in portions of the brain and spinal cord, an interruption in the transmission of impulses from nerve endings to muscles, progressive weakness and loss of sensation that begins in the lower extremities, loss of coordination and stiff cogwheel rigidity. Question 4. The nurse has just admitted a client with emphysema. Arterial blood gas results indicate hypoxia. Which physician prescription would the nurse implement for the best improvement in the client's hypoxia? Option A. Elevate the head of the bed 45 degrees. Option B. Encourage diaphragmatic breathing. Option C. Initiate an alupant nebulizer treatment. Option D. Start O2 at 2L/min. The correct answer is option Nan.